Hi guys, hope you're doing good. A really quick video on time management. I get a lot of questions asked of me of how do I make my time management better when it comes to things like CSA exam, plab 2 exam, etc. Now, time management is something that people really struggle with, and the reason people struggle with, they always try to cover the same material in a quicker time. So for them, time management is all about how do I get things done quicker? How do I make my data gathering quicker, my first half quicker? How to do my management plan quicker? Basically, how do I squeeze in everything but in a condensed period of time? Now, this is where I think people make a big mistake, because it's very hard to try and cover a certain amount of material in a quicker time. This is a role play situation. You're talking to another person. It's got to go back and forth. You can't just dictate the speed of something. Someone might be slow, embarrassed, worried about something, and you can't speed up time beyond a certain point. So when I was preparing for my CSA exam, I made this mistake. I was trying to go and say, look, how do I get my stuff done by a certain time? How do I get quicker? And it just puts a lot of stress on your head, because you look at the time's running away, you think that I should be here by now, and I'm not here by now, and it starts to get you talking faster, and eventually your second half is very rushed because you're trying to do things quicker because you're just trying to cram everything in. So when we do teaching for things like plab 2 or GP stage 3 or CSA, we talk a lot about making every single minute count. Every minute is vital, and one of the key things with time management is to make sure every single minute counts. Make sure there's no dead time. A lot of the time, whether it's in the first half or the second half, there's a lot of stuff that's being said to try and fit it in and done at a really quick pace to try and make your time management better, but actually does nothing for the consultation, does nothing for your end score. It's not scoring you any marks. Let me give you a couple of examples. Say, for example, you're seeing someone who comes in with knee pain, and sometimes you get a bit of information on the card and it tells you a lot about where this person has got to in their story. There's a big difference between someone coming in with knee pain and it's their first assessment, or someone who's been seen for 2 or 3 times with knee pain. They've had an orthopedic opinion, they've had an MRI scan, you've got a diagnosis of an cruciate ligament tear, for example. Now, where you start your first half is very different from one case to another. Now, if it's, this is knee pain, query cause, do an assessment, then you've got to go right back to the beginning and ask them the story, what was happening, and did you have swelling, and how long was the swelling there for, and did you have locking, and did you have all this kind of stuff. Whereas if you start this case and it says this person has had an MRI scan and this is the findings, please have a chat with them, that's very different. You don't need to go back to the beginning and do the whole story and take 3 or 4 minutes just catching up to the point that you've just been told to enter the story at. So you just very quickly bring it to that point. Mr. S, I can see you had a bit of trouble with your knee recently. Looking at the notes, I can see you've had an MRI scan, and it looks like you've got this tear in your cruciate ligament. Is that correct? And your data gathering, your history starts at that point. How is it right now? Is there any more swelling? Is there any more pain? Is there any locking? So you save a lot of time. It's not that going back to the beginning and asking 50 questions about the knee from the beginning is wrong. You don't lose any marks for that probably, but you certainly lose time because it's very low value questions. It's not going to change what you do in the second half. Another example in data gathering where we can lose time. Sometimes we like to just go through everything as if it's a tick box, even though it's not going to really change our plan. And the classic example that I see for this is when people talk about things like past medical history and drug history. So say you're sitting in a GP setting and you've been given a whole load of notes of someone. This person's had 3 MIs in the past, they've had hypertension for X number of years, they've had 2 hip fractures, they've had a cataract surgery, they've had their appendix out. They're on 4 or 5 medications. They may come in with, elbow pain. Now, often what I see people do is they just literally read out all of this stuff. So I can see that you've had an MI in the past. I can see you've got hypertension. I can see you've had 2 hip operations. I can see you've had a cataract operation. I can see you're taking this medication, this medication, this medication, this medication, this medication. Can I check if you have any allergies? Now, it's not wrong to do that stuff. It's not that you're going to lose a whole bunch of marks probably, but you're going to lose a lot of time, and that information, those questions are not going to change what you do in the second half. So when it comes to time management, it's about cutting out all of those questions. If, for example, someone came in with chest pain and they've got that history of 3 MIs, then yes, I'm going to go there. Mr. X, I can see you've had a couple of heart attacks in the past. Was this chest pain you're talking about now similar to then? Now that's relevant use of past medical history. But if someone comes in with elbow pain, I'm not going to go and reel down all of those lists of things that are right in front of me, because it doesn't add to my assessment of that person. That data is not adding to my ability to understand the situation and take it forward. So with time management, you can try and be as quick as you can and go through those things, but that doesn't mean it's good time management. You're just rushing through questions for the sake of it and has no impact on what's going forward. So 2 really quick examples from a data gathering point of view of how we lose time very quickly. Number 1, we don't always need to go right back to the beginning and do the whole story if you've been put into a certain point of that story already. And secondly, you don't need to just run through reams of information that's given to you on a card just for going through its sake. Straight away you're going to cut out a couple of minutes in your data gathering, which you can use much better in your second half in a more time efficient way. Let's talk about the second half then. So when we talk about management plans, often we see people have very little time in the second half. They maybe have 2 minutes, 3 minutes, 4 minutes. It's not necessarily how long you have that's key. And it's more about what you do in the time that you have. Now, 2 minutes may be enough for a management plan as long as you manage your time really well. So when it comes to time management in the second half, one of the things we talk a lot about at our courses and our training is making sure the first minute, the first 90 seconds are really high efficiency. Like, you get a lot of stuff out early on, you show where your mind is, you show that even if I don't finish this whole thing off, my base is sound, I know where I'm going, I know what the issues are, I know where I'm going with this plan going forward. Because in most consultations in real life, you don't get to finish absolutely everything and deal with all of the issues, the clinical, the non-clinical, the psychosocial, everything in one go. But I want to get to a point very quickly on where I've demonstrated that I understand the core issues. Now, I've done another video somewhere else on YouTube about how thinking about managing the situation is better than managing the condition. This is one part of effective time management, making sure that you're showing the bigger picture first, and then you start to tidy up and go into more detail. Often what people think time management is in the second half is getting through everything one by one really fast. So because we're trying to achieve something in a very time efficient way and we know we've got lots to cover, we start talking really, really fast to try and make our time work better for us. But that loses into personal skills, you lose connection, you lose rapport, it's very doctor centered. So time management, remember, is not about doing things quicker. It's about making sure that the time that you have, you use as effectively as you can, whether that's data gathering or whether it's management. If it's data gathering, don't ask every question under the sun. Make sure every question you ask has got a reason. It's something that's going to influence what you do in the second half. Straight away, you'll cut down a lot of unnecessary time. Second half, try and get ahead of the game very quickly. Show the overall picture early on. So manage the first minute and a half as efficiently as you can. And then the rest of it doesn't really matter whether you've got another 1, 2, 3 minutes, because a lot of the hard work is done early. So you're much more efficient in your time. So your time management is much better. Now, we do loads of work on time management and trying to change this concept of how do I do loads of things quicker, which leads you to being more doctor-centered and more formulaic, into making better use of every single minute that you've got. Whether you've got 8 minutes or 10 minutes or 12 minutes, it's about making every single minute count. That is what time management is all about for me when we do our training. Now, we do a lot of teaching like this on our day courses, of course, but loads of discussion on this type of thing in our online courses, in our audiobook courses as well. So have a look at the website, auroramedicaleducation.co.uk, and book yourself one of those courses, even if you can't come to one of our day courses, because we cover this kind of stuff in a lot of detail. So please, please, please take away from this video, time management is not about doing things quicker. It's about cutting out the stuff that doesn't really influence that 8 or 10 minutes. And it's about maximizing time on the really high value questions and the really high value words in the second half. They're going to show that you've got much better control of your time, rather than just trying to go at 100 miles an hour and cover absolutely everything in a very limited time that you get in exams like this. I really hope this helps. Much more like this on our YouTube channel, Dr. Aman Arora, Instagram, Dr._Aman_Arora, and our Facebook page, Dr. Aman Arora. Have a look at those streams if you haven't. We do loads of teaching on communication skills and for clinical teaching as well. Hope this helps. Hashtag can pass will pass. Hashtag I went with Arora. Have a great day.